Hello, I'm Penny Shilling. You may have met my mum, Mrs. Shilling, and my dad, called Bob. My brother is also called Bob. We all produce useful videos for you, free of charge. I have a golden retriever called Tanner and a cat called Tuppence. People ask if we're made of money. Before Tanner adopted me, I was warned off golden retrievers by other dog walkers, because I was told they had so many health issues. Well, I'm not one to take unsolicited advice by non-professional people, so I did my own research, and I pestered my vet until I got all the information. I needed to make an educated decision. Let's face it, every breed has its own list of health issues. Most are because of the unique genetic makeup. Anyway, golden retrievers are generally healthy dogs. And it is our responsibility to look out for the signs and symptoms of these conditions. So, what are some of these common golden retriever health issues? The common ones include bloat, cancer, chest and skin problems, hip and elbow dysplasia, hypothyroidism, luxating patella, ear infections, epilepsy, eye problems, von Willebrand disease. I need to say that this list is not exhaustive, although these are some of the most common. So, I will go through each one in different videos instead of one very long one. I would ask that you comment too, and please hit that like button. And if you would like to see more of the videos, please click the subscribe button below. Cancer. Gosh, that word fills me with dread. Golden retrievers exhibit the highest rate of cancer of any breed of dog. Why is this? Research by scientists at the Animal Health Trust uncovered that 70% of Labrador retrievers and golden retrievers carry a genetic factor, which increases their risk of developing mast cell tumors. However, there isn't a lot of knowledge as to why. The sad truth is that 60% of golden retrievers die of cancer. 57% of female dogs and 66% of males. This is almost twice the rate of cancer in dogs of all breeds. These figures are according to Dr. Karen Becker, the most followed vet in the world, and for good reason. The two most common cancers are hemangiosarcoma and lymphosarcoma. Hemangiosarcoma is a very aggressive form of cancer that originates from cells that line blood vessels. It is the most common form of tumor affecting the dog's heart, accounting for around 69% of heart tumors. Apart from the heart, it is also the most common malignant tumor to affect the spleen. The signs and symptoms highly depend on where the tumor is. Hemangiosarcomas of the skin usually presents itself as a small red or bluish-black lump. It is important to note that they can also sit deeper under normal-looking skin, so are invisible to the naked eye. When they are located in the liver, or spleen, they often grow rapidly, forming cavities that contain blood. They often only present signs after they rupture, and cause sudden bleeding, leading to blood loss. This can lead to weakness or collapse. Probably the first knowledge a dog owner has of this condition is at the vet's. A collapse can also be a result of abnormalities in the rhythm of the heart, and can happen in primary heart tumors, but also those in the spleen. These tumors can be picked up early, when swelling of the abdomen is noticed, or even querying other signs of an unknown illness. Bleeding from the nose is a red flag, because the tumor and blood loss has caused blood clotting, forcing blood to be released through the nose. Once any signs are spotted, or there are suspicions of illness, it is important to visit your vet. If they observe such lumps or bumps, hidden, or otherwise, the vet may advise a biopsy, or removal of the mass. If there are visceral forms, these are organ-related and any diagnosis can be challenging. When a dog is suspected of having a heart, splenic or liver hemangiosarcoma, they are more likely to have arrived as an emergency. Due to severe internal bleeding, when undergoing an ultrasound scan of the heart or abdominal organs, a mass may be found and cause suspicion. Where the complications arise is when benign tumors, malignant tumors, such as hemangiosarcoma, or non-tumors can look similar on an ultrasound scan, however, they would each carry very different outlooks. Metastasis will be suspected if there is evidence of more than one organ being affected, increasing the likelihood of hemangiosarcoma. Unfortunately, there is currently no absolute method of confirming the mass type until tissue samples are examined after surgery. A recent study showed that 63 to 70% of dogs that present to the vets with abdominal bleeding have hemangiosarcomas. With the exception of those involved in trauma. There are occasions where a mass is picked up during an ultrasound scan for a different medical issue. The silver lining is that it gives more time for decision-making and of course surgical planning. Let's look at how these tumors are treated. You may hear the word subcutaneous in relation to tumors. It simply means under the skin. You may also hear the word metastases. This means spread to other sites in the body. Because 30 to 60% of these tumors will metastases, it is crucially important to have them removed. Unfortunately, they may have already spread at the time of diagnosis. Where there are tumors extending into deeper tissues, these may benefit from chemotherapy or radiotherapy, in addition to other surgical procedures. Surgical removal of the spleen is required for splenic hemangiosarcoma, with an additional option of chemotherapy. There may be side effects with chemotherapy drugs, such as lethargy, anorexia, vomiting, diarrhea, and fever. It must be said that these drugs are usually well tolerated. Mild to moderately low white blood counts occur in up to 50% of dogs receiving this treatment but usually do not require treatment. Be mindful that splenic masses often present as an emergency under these circumstances. Decisions regarding surgery often have to be made before there is a clear diagnosis. Like human tumors, there are stages in relation to hemangiosarcoma. Once skin and subcutaneous tumors are removed, they can be examined for more detailed information on the severity or stage of the tumor. Stage 1 tumors just affect the skin and are associated with an average survival rate of 2 years. Stage 2 and 3 tumors that either involve the subcutaneous tissues or muscle have a worse prognosis if treated with surgery alone. Chemotherapy or radiation therapy may improve the prognosis for stage 2 and 3. I'm sad to say that hemangiosarcoma of the spleen does tend to carry a poor outlook. These are all too often malignant, and survival is less than 3.5 months with surgery alone. And very few dogs living beyond 12 months. Where there is no evidence of it spreading, or tumor rupture, and chemotherapy is used, there is an average life expectancy of around 8 months. If the tumor has ruptured, this event could be expected to reduce to an average of 6 months. The other most common cancer in golden retrievers is lymphosarcoma. This is a cancer of the lymphocyte, a type of blood cell. Lymphosarcoma is also known as lymphoma or non-Hodgkin's lymphoma. It is a cancer of white blood cells but can affect anywhere in the body, and over 50 different forms of lymphoma, so it is a very varied condition. The good news is that the majority of these forms can be successfully controlled to stop your Goldie feeling unwell. It is most often treated with chemotherapy. Let's talk about the signs and symptoms of lymphoma. If your Goldie has a skin infection or indeed skin lesions which are not healing or not responding to antibiotics, then it's certainly worth further investigation, such as a biopsy. The lesions could be skin lymphoma and lead to scaling lesions on the dog's skin. However, the most common forms of lymphoma will generally result in enlarged lymph glands. These are generally not painful. Lymph nodes are present all over the body, but are easiest to identify are under the chin. Behind your dog's knees, neck and shoulder area. The lymph nodes are important because they filter blood and store white blood cells. As they increase in number, the lymph nodes in that affected area begin to swell. This is why swollen lymph nodes are often the first indicator that there is something wrong in your dog's body. Signs and symptoms in dogs with lymphoma include decreased appetite, increased thirst, lethargy, unexpected weight loss.
Don't be surprised if your dog appears to be quite well, because in many cases, despite the presence of lymphoma, dogs do not always appear to be sick.
You should contact your vets if you are concerned about your dog having any of these signs. For a diagnosis, your vet will take a sample of cells. In the event of the initial testing being inconclusive, there are other tests that can be performed. Your vet may also advise blood tests and possibly chest X-rays and ultrasound of the abdomen. There is good news, often lymphoma can be successfully managed. There's a whole host of varying forms of chemotherapy. There are tablets and injections. And timing of these treatments will vary from daily to weekly or even one every 3 weeks. It all depends on the type of lymphoma, your dog's own well-being and of course your preference. Your vet may suggest other treatments such as antacids or anti-sickness medication to work alongside the chemotherapy. Another suggestion by your vet may be some supplements or changes to their diet to help them feel as well as possible during the treatment. Please remember that there is no magic pill. Even chemotherapy treatment may not be the right option under certain circumstances, and palliative care may be the best option. On a final note, many dogs receiving chemotherapy have minimal to no side effects with chemotherapy. In fact, a lot of dog owners say that friends and family are often very surprised and say that they really can't believe the dog is receiving treatment. Well, I hope you have found this video useful. I'd love to read your comments below, and I'd be very grateful if you would subscribe by clicking on the subscribe button below. By doing this, you support our free videos and it shows us that you would like to see more. The more subscriptions, the more videos we will provide totally free of charge.